Question is, what are the messages for recreational athletes, people who are not elite athletes but are interested in sport? And I think the first message is a really important one, and that is sport and physical activity is good for health. We need to remember that the elite athletes are at an extreme end, and it's probable that, as with other areas of risk in medicine, we have a kind of U-shaped curve, where if you're doing no physical activity, you're at much greater risk of disease. If you're carrying out moderate level of physical activity, or even quite high levels of physical activity, it's beneficial to your risk of disease and your health. But if you are engaged in very intensive training at an elite level, that might start to induce risk. So what are the messages for the recreational athletes? Well, some very clear messages. Visit your dentist, get a checkup at least twice a year if you're engaged very seriously in sport, because you may still be at risk. We know that these conditions are very easy to prevent. So as well as having a checkup, talk with your dentist or the hygienist about what's good for you. What do you personally need to improve? How can you reduce your risk of developing gingivitis and periodontitis? And think about your nutrition very carefully, because there's a lot of products around, and I think a lot of people see other athletes having a lot of sports drinks. And remember that although that is really important at the highest end of the spectrum for sport, many of us, and I'm a very keen recreational athlete as well, many of us really need very little of that. And things like water and milk are probably the best drinks for rehydration. They're very cheap, they're very kind to the mouth. So just think about your general nutrition and make sure you're not using things which are really unnecessary for you.
And just the last question, regarding oral care,